Have you ever eaten avocado and experienced unexpected effects? So it could be that you are affected by one of the conditions that we are going to see. Avocado is a delicious fruit, full of fiber, healthy fats, and very useful nutrients for your health. But did you know that it's not suitable for everyone? Yes, that is indeed the case. Some health conditions are not compatible with avocado. If you feel concerned about any of the following situations, it would be better for you to avoid this superfruit. In this video, we'll explore why avocado may not be right for everyone. Stay with us to discover these situations, but before diving into details, don't forget to subscribe to our channel and share this video if you like health tips. Which of these health conditions have you already experienced? Share with us in the comments. Let's get started. Problem 1. Situation of taking anticoagulant medications. Although avocados are generally a safe and healthy food, they can interact with certain medications, especially blood thinners like Warfarin. Here's why this happens. Avocados are rich in vitamin K, essential in blood clotting. Many people have no problem with this because vitamin K is an essential nutrient that helps maintain strong bones and good blood clotting. However, if you have a medical condition that requires you to take blood-thinning medications such as Warfarin, consuming large amounts of vitamin K may decrease the effectiveness of the medication and put you at risk of dangerous blood clots. So if you're taking Warfarin or another blood-thinning medication, be careful about your avocado intake. Preferably, avoid them completely during your treatment or reduce your consumption to reduce the risk of serious complications. Problem 2. Kidney stones. A key component of avocado to consider is oxalate, an element also found in many healthy foods. For some people, excessive consumption of oxalates can lead to the formation of kidney stones, a painful problem that can interfere with the normal functioning of your kidneys. Oxalate binds to calcium in your body to form crystals, which over time can become small pebbles. Although not everyone develops kidney stones from consuming foods high in oxalates, it is important to be vigilant if you have a history of kidney stones or risk factors. Problem 3. Histamine intolerance. Histamine is a substance naturally produced by our body, also present in certain foods such as avocado. Some people may have a histamine intolerance and experience problems every time they consume avocado. If every time you eat it you experience itching, rashes, hives, digestive problems such as abdominal bloating, diarrhea, abdominal pain, headaches, or even breathing problems, you might be intolerant to it. Histamine. This condition is usually treatable, but not in everyone. The causes of this intolerance may be a genetic predisposition in some people, while others may develop it due to underlying health conditions such as an imbalance in the gut or a deficiency of diamine oxidase, an enzyme that breaks down histamine in the body. If you have any doubts about a possible histamine intolerance, it is important to consult your family doctor. This can help you rule out other underlying illnesses and recommend appropriate tests or treatments. In the meantime, if you notice that eating avocados causes unpleasant symptoms, it might be best to limit your intake or avoid them altogether. Problem 4. Kidney disease. A situation of kidney failure is not compatible with the consumption of avocado, because despite their status as a healthy food, avocados can cause difficulties for those who suffer from impaired kidney function. I explained to you, avocado is rich in potassium, a mineral essential for the proper functioning of the heart, muscles, and nerves. But if the kidneys are weakened, they may be unable to remove excess potassium from the blood. Potassium overload can cause a dangerous condition known as hyperkalemia. If you have kidney disease or are at risk of developing it, carefully monitor your avocado intake. Talk to your doctor. He or she can help you determine the safe amount of potassium for you, depending on the stage of your kidney disease. Problem 5. Latex allergy syndrome. If you're allergic to latex, avocados can also become a challenge. This happens when your immune system cannot distinguish certain proteins found in avocados and latex. These similar proteins can cause an allergic reaction even if you are not allergic to avocados per se. This phenomenon, called cross-reactivity, can cause a variety of symptoms ranging from mild irritation, such as itching and swelling, to more serious difficulty breathing. It is important to understand these connections between proteins to better manage your health and avoid these potentially dangerous reactions. Learn to recognize and treat these unexpected allergic reactions by exploring how similar proteins in avocados and latex can affect your body. Problem 6. Digestive disorders. This problem affects millions of people around the world. If you're one of those who struggle with conditions like irritable bowel syndrome or FODMAP sensitivity, you may need to exercise caution when eating avocados. First of all, you need to understand what FODMAPs are. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It's not a complicated word, is it? However, these are short-chain carbohydrates that are poorly absorbed in the small intestine and can cause digestive problems in some people. Avocados contain two types of FODMAPs, a polyol in the form of sorbitol and fructose, a monosaccharide. When these compounds enter the large intestine, they can attract water in the intestines and ferment, leading to symptoms such as abdominal bloating, gas, abdominal pain, and diarrhea. If you suffer from irritable bowel syndrome or are sensitive to FODMAPs, eating avocado may trigger or worsen digestive symptoms. However, it is important to note that everyone's tolerance level is different. Some people with irritable bowel syndrome can eat a small amount of avocado without experiencing problems, while others must forgo it altogether. So if you think avocados may be contributing to your digestive issues, try eliminating them from your diet for a few weeks and see how you feel. Monitor your symptoms and look for patterns or correlations with avocado consumption. And if you need to limit or avoid avocados, there are many other delicious and nutritious foods you can try having in place of avocado. Problem 7. Oral allergic syndrome. It occurs when people with pollen allergies such as hay fever have an allergic reaction to certain raw fruits, vegetables, and nuts. This syndrome is similar to latex allergy syndrome because the proteins in these foods have a similar structure to the proteins in pollen, which causes a cross-reaction. If you are allergic to birch, ragweed, or grass pollen, you will be more likely to experience symptoms after eating avocados. If you think you may have one of these allergies, it is important to consult an allergist for proper diagnosis and treatment. An allergist can perform skin or blood tests to determine if you are allergic to specific pollens and fruits. If you have a known latex allergy, the best way to prevent a reaction is to avoid allergenic fruits. It's essential to consider these health risks before consuming avocados, especially if you have underlying health conditions or are taking medications. If you are unsure about how avocados might affect your health, talk to your doctor or a qualified healthcare professional. With a balanced diet and a good understanding of your individual needs, you can enjoy the health benefits of avocados while minimizing the potential risks. So, before you get tempted by your next avocado, be sure to keep these 7 health questions in mind. And remember, the key to healthy eating is moderation and informed decision-making. Thanks for watching the video. If you found it useful, give me a thumbs up, subscribe. Which of these problems do you experience after eating avocado? Share your experience in comments. See you soon.